When do you see a doctor for an ankle sprain? What I usually recommend is that if the ankle sprain is severe, meaning that there's massive or significant swelling and bruising that occurs, that it's probably appropriate for you to see your foot and ankle doctor within a 1 to 2 week period of time after the sprain. The emergency room might be appropriate if it's at a time when you feel that you need to be seen urgently, or you feel that you can't put weight on the ankle that might indicate a fracture or a broken ankle or something else that might be more serious. Now, if you do see your physician, there's going to be several things that he or she will recommend. The first thing they're going to recommend in most cases is some type of immobilizing the ankle, and that might mean the use of a fracture walker boot or a brace, and that type of device would be used anywhere from a few days up to 2 weeks. And with an ankle brace, where it allows for some motion, you might even use that ankle brace for up to 6 or 8 weeks, depending on how severe the sprain is. In my office, I've usually recommended patients see a physical therapist after anywhere from a moderate to severe sprain, and hopefully within a week to 2 weeks after injury. And the reason for this is a therapist can do very, very effective things in restoring ankle strength and balance, which are the most important parts of an ankle sprain recovery. Now, if an ankle sprain causes persistent pain beyond 3 months, that's where we start to consider other kinds of injuries that might not get better on their own. And so I usually recommend that if you haven't seen somebody within 3 months after an injury and the pain and symptoms persist, then it's appropriate for you to see your physician or foot doctor at that time. And at that point, they're going to recommend an x-ray initially, and then they're also going to consider at that point physical therapy if you haven't done so. And then if the x-ray shows an injury to cartilage or some type of other significant problem, surgery becomes the way of treating an ankle sprain that persists. Usually an ankle surgery that's going to happen after ankle sprain will be an ankle ligament repair. We call that a Brostrom procedure or a lateral ligament reconstruction. And that usually involves the use of either anchors in the bone or sutures to close down the tissue over the ankle where it's been injured. And in those cases, this is a lateral ankle sprain, or the outside of the ankle. And what they'll do is make a small incision along the outside edge of your ankle and tighten up ligaments that occur or that attach right to the bony prominence of the outside of your ankle. And then you'll be in a cast for usually up to 2 to 4 weeks, sometimes 6 weeks, and then some type of fracture walker boot afterwards for until about that 6-week point when physical therapy becomes very significant after surgery. Ankle ligament surgery is about 95% effective with good to excellent results by most studies that have been done. And so it is a good way to restore function in your ankle if it's not good after that 3-month period of time of injury.